Welcome to Parenteral Medications, Part 1. In addition to the 6 rights and 3 checks to ensure patient safety, when it comes to parenteral medications, we have to make sure that we are safe to protect ourselves. There are approximately 600,000 to 1 million reported needle sticks each year. Those are just the reported ones. That's not including anyone who chooses not to report their needle stick. I've listed some tips to help you to not get a needle stick injury. Number 1, after drawing up the medication, recap the needle using the one-handed scoop method. Do not use 2 hands. Number 2, do not recap dirty needles. And number 3, use needles with a safety device whenever possible. I'll say that unless there's supply chain issues, most facilities have needles with safety devices. This should not be a major issue. And then this picture right here is my picture. I recapped my own dirty needle using both hands when I was distracted in my kitchen, and I stabbed myself in the thumb with that needle that you see right there. It went right through the plastic, right through the cap, and because I was using the 2-handed scooping method, I did poke myself. If you do receive a needle stick with a dirty needle, you need to follow the CDC and NIOSH recommendations. First, you need to wash your hands with soap and water. Then you need to report the incident to your instructor and the charge nurse wherever you are working. Your instructor is going to alert your main professor, the chair of the program, and college safety. And then the chair is going to follow the college guidelines for telling you what you need to do to seek medical care. Parenteral medications, like injections that you're going to be learning in Block 1, are used to instill medications directly into body tissues for systemic absorption. We choose this method or medication administration for a variety of reasons. And the first one is parenteral medications are absorbed and act faster than PO medications, so they are great for urgent and emergent situations. Some medications are only made for the parenteral route. There is no PO equivalent. And sometimes patients can't take anything by mouth, so we can't give them PO medications. Unfortunately, injections are not risk-free. They do have risk of infections and nerve damage. Both of these risks can be directly related to the nursing technique. Another risk is error. Once you give that injection, you can't take that medication back. So you really need to follow the 6 rights and 3 checks. Make sure that your math is accurate, and you need to monitor your patient for side effects. This picture right here is an injection site that was bruised. You can see a little bruise there on the left. And then it developed localized redness from cellulitis, which is a skin infection. There are 3 types of injections routinely given. We have subcutaneous, which is usually called sub-Q. These injections go into the looser, fatty subcutaneous layer of the skin. Sub-Q has a slower absorption rate than the muscle because it has less blood flow than the muscle. And this site is used a lot for insulin and anticoagulants. The intramuscular or IM site has the injection going into the muscle. Muscles have a faster absorption time due to the increased blood flow, and it's used for more irritating medication like vaccines or antiemetics or antibiotics. And intradermal or ID injections go just below the epidermis into the dermis. This area has little blood flow, and these injections stay localized, meaning they don't really travel around the body. We use this type of injection for skin allergy testing and for TB testing. Besides those 2, it isn't really used that much. This picture here is an illustration of where the needle tip ends up for each type of injection. So if you start from the left, you'll see intramuscular. That needle tip is going all the way down into the muscular layer. And then we have 2 different types of sub-Q, one where the skin is not pinched and that needle tip ends up in that fatty layer. And the second picture is where that skin has been pinched and it's in that fatty layer. And then the third one is where they're going in at a 45-degree angle to stay in that fatty layer. And then if you look all the way to the right, that intradermal, that needle is ending just in that epidermis, like just in that dermal layer right under the epidermis. So this just kind of illustrates where these needle tips are ending up. So this picture shows the most common type of syringe you will see, again, if there are no supply chain issues. This syringe is a Lorlock syringe, meaning that needle locks into the syringe. It kind of screws together. This second picture is of a slip tip connection type of syringe. Slip tips do not have a lower lock, so the needles do not lock into place. If you're wondering, they don't like fall off when you turn the needle upside down. They do kind of stay on, but they're more of like a pressure tip. They don't lock into place. They're definitely not as secure as a lower lock, but they're not unsafe either. This third picture is of insulin syringes. Insulin syringes always have an orange cap, and they have units as the unit of measurement instead of mLs. Insulin's always ordered and always given in units. All of these syringes have a plunger and a barrel. The difference really is whether or not it has a lower lock or not. Here are just a couple more tips when using syringes. Only touch the outside of the barrel. We don't want you to touch the shaft of the plunger, and of course we don't want you to touch the needle. We want to try to keep the shaft of the plunger as sterile as we can. And when we're drawing up medications, we need to make sure we keep the tip of that needle inside the fluid. If it's inside the fluid, that's a good chance that we're not going to get poked with it. Needles come in different lengths and gauges. We'll discuss specific lengths and gauges when we discuss each type of injection, but I wanted to give you a little overview about needle gauges. Needle gauges are important for nurses to know, and it can take a little bit of time for the numbers to make sense in your head. With gauges, the smaller the needle gauge number, the larger the needle diameter. So an 18 gauge needle is going to be a lot thicker than a 25 gauge needle. We use larger gauges, which have smaller diameter, for medications that are more watery and less viscous. Because that needle is so thin, we need thin fluid to get through it. The smaller gauges also cause less tissue trauma than larger gauges, and less tissue trauma generally means less pain. We use smaller gauges or larger diameter needles for medications that are viscous and hard to push through the needle. The smaller gauge needles are thicker and therefore cause more tissue damage and more pain. Medication vials, like this insulin vial in the picture, can be made of glass or plastic. They have a rubber stopper at the top of it where the needle goes into, and then there's a metal ring keeping the stopper in place. Vials will have the medication name, concentration, and expiration date written on them. Depending on the size of the vial, some may have mixing instructions or storage instructions written on them as well. Some vials require you to shake the medication to mix it, except insulin. Do not shake insulin. You're going to roll insulin gently in your hands. The reason is we give such small doses of insulin that if the vial gets air bubbles in it, you're going to waste so much time waiting to get those air bubbles to dissipate so you can actually draw up the insulin. And insulin is also the most common vial that we use multi-use. This means we use it several times. We must label the vial with an expiration date 30 days from opening, and every time we use that vial, we have to clean the top, that rubber stopper, with alcohol every single time we use it. Here we have pictures of medication ampules. These are made of glass, and you have to break the tip off to get the medication out. Before you break the tip, you need to make sure that all the medication is at the bottom of the ampule. Then we're going to crack the tip off. We're going to use a special filter needle to draw up our medications. The filter needle makes sure that we don't draw up any tiny glass particles. We also don't inject any air into the ampule like we do with vials. After we draw up our medications, we do have to change the needle to the appropriate needle for injection. A filter needle cannot be used for injection. When you actually see what a filter needle looks like in Skills Lab, you'll understand why. We're going to practice cracking open ampules and drawing up our medication in Skills Lab. The last type of container for parenteral medications is pre-filled syringes. These pre-filled syringes are single-use only, and not every medication comes like this. Some come with needles already attached, and some don't. It's very manufacturer specific. My favorite type of pre-filled syringe is the Carpuject, which is the picture on the right-hand side. They're meant to be used with their own special plastic holder, which is that clear and blue piece. But those little clear and blue pieces are really hard to find. So what most people do is they just use the bottom picture, that green and clear and white piece. They use that as like it would be its own vial instead of trying to find the blue and clear piece. And this is the end of part 1.